Hello, I'm Hannah Heredia, a registered dietitian with Optum Infusion Pharmacy from Chandler, Arizona, presenting this abstract along with Courtney Wood, board certified nutrition support pharmacist, about a comprehensive review of clinical strategies utilized for enterocutaneous fistula patients receiving home parenteral nutrition. Thank you so much. So, an enterocutaneous fistula, or ECF, is a common clinical indicator for home parenteral nutrition, HPN. This is a condition that's characterized by an abnormal connection developing between the stomach or intestinal tract and the skin. This abnormal connection usually occurs following bowel surgery and results in the contents of the stomach or intestines leaking out onto the skin. An ECF can be classified as either low output, less than 500 mils, or high output, above 500 mils, based on the volume of fluid leaking. Management of ECF often requires the patient to follow a strict nothing by mouth, or NPO, status, and the loss of fluid from the ECF can result in the inability to maintain adequate fluid, macronutrient, electrolyte, and micronutrient status, and often necessitates the use of parenteral nutrition. The American Society of Parenteral and Enteral Nutrition, ASPN, has developed best practice recommendations in regard to ECF management. These include recommendations for calorie, protein, fluid, along with trace elements, specifically zinc. So medical records from a nationwide HPN provider were reviewed with data collected from 49 patients. This review examined whether patients received a 4-oil IV fat emulsion, additional zinc supplementation, carnitine supplementation, and subcutaneous octreotide. Charts were also reviewed for calorie, protein, and fluid provided based on each patient's actual or adjusted body weight. These were then compared to the best practice recommendations as published by ASPN. Upon review, while octreotide is known to be an effective management strategy to reduce ECF output, only 22% of patients were receiving the drug. Approximately 39% of patients were receiving IVFE as their fat source, and only 10% had carnitine added to their PN formula. While best practice recommends supplementing with additional zinc for losses in ECF fluid, 65% of patients reviewed had a standard trace product containing 5 milligrams zinc in the PN formula with no additional zinc. ASPN recommends 10 to 15 milligrams zinc to account for ECF losses. 74% of patients were at or above the best practice recommendation of 1.5 to 2.5 gram per kilogram per day of protein. Energy requirements are suggested to be 25 to 35 kcal per kilogram per day, with 76% of patients meeting the standard. To account for fluid losses from the ECF, it is recommended that the fluid goal be 30 to 40 ml per kilogram per day, and only 57% of patients in this review met this guideline. Enterocutaneous fistulas are a common condition for which PN is prescribed. There are several options to aid in output management and healing, along with best practice guidelines to meet protein, energy, and fluid goals. Collaboration between the nutrition support team and providers to adhere to national standards and guidance could help better promote healing of ECFs and optimize patient outcomes. Thank you so much.